Welcome to Courageous Journeys with me, Theodora. Courageous Journeys was created to inform, empower, and inspire you. Today we'll be taking a closer look at what it's like to live with bipolar disorder. Our first guest is Dr. Bradley T. Wajda. Dr. Bradley has amassed an extensive experience in adult and childhood psychiatry, as well as comprehensive substance abuse treatment during 25 years of practice in the Central Valley. He served in many local inpatient and outpatient positions, including that of Corporate Medical Director for Kingsview Corporation and Medical Director for Kingsview Substance Abuse Treatment Program in Tulare County. He now created Insano. Insano represents Dr. Wajda's most recent endeavors to enhance the scope of mental health services available to the general public. They offer a range of treatment options that are personal to the needs of each individual. We'll be learning later on today some of those treatments as we discuss bipolar disorder. I'd like to welcome Dr. Wajda. Thank you for coming this morning.
Bet.
I appreciate your time. So we're gonna jump right into what is bipolar disorder and talk about that. I know you have several areas that you work with patients on. And after doing quite a bit of reading, it's not easy. It's pretty tricky, especially when disorders or mental illnesses cross over.
Well, I mean, bipolar is misdiagnosed, underdiagnosed, and overdiagnosed. I mean, it's a difficult situation because, I almost don't know where to start. So let's just start with the presentation. So many mental health, these are mental health professionals that should know better, but, what they do is they hear that a patient has mood swings, and when that happens, they immediately, and as they should, include bipolar in that diagnostic consideration. However, the problem with that is, rapid mood swings are easy to see. If you're having mood swings that are occurring, several times throughout the day, so many people, especially in the lay public, want to say, aha, you're bipolar. And unfortunately, there are a lot of mental health practitioners that'll say, absolutely, you're bipolar. That's not bipolar.
Right.
And the mood swings that are bipolar require time frames that you measure in weeks. If you're using mania as a yardstick, for example, and we'll talk about what those symptoms are here in a minute, but if it's a manic episode, it has to last a week. And at that point, if you have one manic episode, you qualify for bipolar illness. Then it's a matter of classifying it beyond that. When you use a hypomanic, which is same symptoms but less intense, it has to be at least 4 days. And if you're using hypomania, then you have to look at the depression, which has to meet the criteria for major depression and be present for at least 2 weeks. So some people who have legitimate bipolar don't get diagnosed as bipolar because we're looking at mood swings that are taking place over several weeks. So to some family members or other people, they're thinking,
They're just depressed.
Well, they're just depressed and now they're feeling better. They had a good week.
Right.
And so that's why I say it's both overdiagnosed and underdiagnosed, because bottom line is it's just misdiagnosed. So.
I can definitely see how that can happen, especially right now, looking into several different areas of mental health, since we'll be focusing on that in September, in schizophrenia and ADHD and depression. And then, like I said, when you have crossovers, it can be very complicated. So let's talk specifically. You did mention some of the actual symptoms of bipolar disorder. Explain that in further depth, but also then discuss the mood episodes and how that relates to the symptoms.
Well, a manic episode is defined as an elevation of mood or irritability. It can be pretty much either one. But during that time, it's severe enough to affect your level of functioning. occupationally, socially. I mean, people would look at you and say, wow, you're not right. Something is wrong. You would have rapid pressured speech where you're having a real hard time trying to get everything out because you're trying to stay ahead of some really racing thoughts. Have some flights of ideas where you're, oh my gosh, I want to go write this book because it's going to be a bestseller, and I've got to go clean the house, and I've got to stay up all night. My favorite color's red, and I want to go buy a new computer. And, I have patients who are writing checks in crayon to online TV ministries for $3 million, and they can't even make the rent. They have a psychomotor agitation is what it's called, but it's very physically agitated. Grandiose ideas, as I alluded to, they may believe that they're really going to write a bestseller.
Well, can I interrupt you just for a second? And
just for a second.
Talk about that, because the time span. So when an individual has some of the things you just talked about, as far as days where they've got racing thoughts, they have grandiose ideas of what they can accomplish, but then, and the ideas in trying to focus on one particular goal at the moment to get that done, to accomplish it, but this is happening more on a daily basis. If someone comes to you and tells you that that's happening, what would be your first thought versus bipolar disorder?
Well, not sure I understand what you're asking me. You're saying that they're doing a single thing every day, or?
No.
Or they have increased goal-directed activity, which is the phraseology that's used in the DSM to talk about if you're manic, then you start taking on a lot of responsibility. You're telling people you're going to do a lot of activities, and in fact, you do a lot, although most of the time you never complete them. But you will commit to a lot of things. You will start a lot of things, and you may, as I mentioned, you may clean the house 3-4 times over. I've had patients that are in the earliest stages of manic, and they're truly as productive. I mean, it's like they're super people.
Right.
And they're getting all kinds of things done, but you can see that it's abnormal, and you can see that it's going to burn out. And that when that happens, they recruited a bunch of people. They got the ball rolling on a lot of things. They promised a lot of money they don't have. And pretty soon it comes crashing down. And
then at that crashing moment, too, then they're looking at all of the things that they did. And then I would imagine that takes them even further into the depression side of it.
Interestingly, it's as they go further into the manic, everything crashes, but they still believe they can pull all this off. I'm serious. It gets delusional. That's why you actually have bipolar disorder with psychotic features. It does get delusional, grandiose delusions. It gets to the point where people tell me, I'm Jesus Christ, I have the ability to read minds, I have the ability to teleport myself.
Does talking to animals count? Because my kids laugh at me because I tell them I can speak to animals.
Well, I was worried about you.
Yeah, I'm sure. I have you on. You got to be worried, right? I'm focusing on mental health. And through my experience, pretty much everybody I know that is a psychiatrist or a psychologist comes from their own experiences in wanting to help others.
Well, I was abducted by aliens and forced to sell Amway, and I still stand by that.
You still sell Amway?
Oh my gosh. Selling soap. But, what's interesting is we're talking about the mania, but again, hypomania are those symptoms, but less so. Those people you do not see as having problems. These people are on it.
Well, that's what I'm talking about. The ones that the symptoms are less, but they're still those things that you're talking about.
Right.
Where they think they can do amazing things. They are organized. People see them as put together while they're getting everything together, and then all of a sudden they're crashing and they're dropping the ball.
Well, see, these people that are hypomanic aren't crashing. The crashing starts once you start easing into mania. The definition of mania is when it starts to affect your level of functioning.
Okay.
Hypomanic people, they describe it, and it has been described as superior functioning. These are folks that really are on it. Cognitively, they're with it. they are super social. They have energy. They need little sleep. I mean, when you're manic, you need little to no sleep, but it's affecting you. I mean, these people, and like in bipolar type 2, and I'm sure we'll talk about this in a little while, you never get to a manic.
Okay.
You're hypomanic for a minimum of 4 days, then you may have what we call a euthymic episode, which is where you're normal, or you may drop down, but to be bipolar for bipolar type 2, hypomania alone, not enough.
Okay.
You have to have a major depressive episode, and it has to be major depression for at least 2 weeks. And that's, like I said, probably where the biggest misdiagnosis comes in, because some people, unfortunately, mental health clinicians will say, this is a recurrent depression. No, it's not. You look at it, the depression comes and goes, but they have little hypomanic episodes.
Okay, well, we're going to look into that further. We're going to cut for commercial and be right back. Thank you.
This segment has been brought to you by Horn Photo in the Bellagio at River Park. For all of your photo and camera needs, go to Horn Photo in the Bellagio at River Park.
Family photos tell your stories. Faces, places, milestones, and moments. You probably meant to preserve those memories. But where are those pictures now? Hiding in boxes or inside the discoloring pages of old albums? Do you own hours of home movies and videotapes that you can't even watch? Slides and negatives that you've saved for all these years and never get to see? Think of all those precious memories that you've saved from the past to share with the future. Thanks to technology, we're taking more photos than ever, but we're not printing them like we should. Those digital images are held hostage on phones, tablets, and hard drives, leaving them as high-risk targets for accidents and hardware failure. What will happen to all of these images that tell your life story? Cherish those captured memories, not by hiding them, but by safely saving them. Put this overwhelming task on your own agenda, or enlist Horn Photo's expertise. Horn Photo provides hands-on help from day one with organizing, scanning, restoring, and duplicating photographs. We can digitize your print and video memories onto DVD for easy viewing and safe, efficient storage. All you need to do is gather your prints, slides, negatives, and videos, then bring them into Horn Photo, where we will care for your cherished memories. In most cases, you can pick up your originals and your DVD within a few days. Once everything is on DVD, it's easy and affordable to order copies of your DVD for your children, siblings, and the rest of your family, so that you can share your memories with everyone. The best part is what can happen once your memories are digitized. We will show you how to transform your pictures into keepsake photo gifts and products you can enjoy for years to come. Don't wait for a disaster to destroy your collection of memories. Take steps to sort, save, and share your life in photos, whether you do it yourself or have Horn Photo help. Stop into Horn Photo and see our full range of solutions for saving and sharing your precious memories.
You can advertise your business, your product, or your event on Central Valley Talk, the Valley's only internet television station. Several of our programs are also picked up on Dish and cable networks. For the best advertising dollar, call Central Valley Talk at 579-1360.
CentralValleyTalk.com.
Welcome back to Courageous Journeys. Today I have Dr. Wajda with me, and we're discussing bipolar disorder. I would like you to explain what a mixed state is.
Well, a mixed state is where you see characteristics of mania and depression. I mean, these are people who, you're going to see the agitation with some of the depression. You know, that's why I say it's elevated or agitated, but you'll see them very agitated, sleepless, mind racing, but depressed.
So when you say agitated, for those out there that maybe don't understand what you mean like nervous and just...
No, I mean more hostile.
Oh, hostile. See,
Yeah.
that's why I wanted you to explain.
Absolutely, more hostile. These are people that you can tell are very volatile. People start, tiptoeing around them.
Easily tempered.
Yeah, they can come across, they can have an expansive mood a little bit. They can seem very inviting, but you can tell that it's tenuous. There's a short fuse, and easily agitated, and they will go off on you.
Well, and they're, unfortunately, that easily agitated characteristic can be found in a lot of people who are alcoholics or suffering from a drug addiction.
Sure.
But also I learned that quite often, so many times, people with bipolar disorder are
Right.
self-medicating, right?
Oh my gosh. Well, 56% of all the people who have a mental health diagnosis abuse substances, which is why I felt like, going into psychiatry, you have to
Look at
provide comprehensive substance abuse treatment. I mean, you can't ignore those numbers. They're huge because, yeah, people self-medicate. Or, on the flip side, there are people who get into recreational drug use, and then it mimics so many mental illnesses, which is, why I used to tease and I used to say I'd have patients who were experts because they read the definitive medical journal Reader's Digest, and they would come in and they'd say, oh my gosh, this is what I've got. But, you do need to talk to a professional because you need somebody who can look at the entire picture.
Right.
And know what's going on, because when we were talking about misdiagnosis, if you have a patient who comes in and they've got rapid mood swings like this throughout the day, they're engaged in destructive impulsivity, which can look like mania. I mean, these are people that are maybe spending too much, they may be hypersexual, they may be binge drinking or even binge eating. They're doing things that are destructive, but it's with these rapid mood swings day to day. That's a part of the picture of borderline personality disorder. However, there are many mental health clinicians that'll look at that picture and say, oh, well, gosh, that's the some of the grandiosity, impulsivity, hypersexuality of bipolar. And once you've made that kind of misdiagnosis, that's a huge disservice, because the treatment for borderline is therapy. It's curative. The treatment for bipolar is medical. I mean, you do supportive therapy for bipolar, but
Because it's more of a chemical
it's
imbalance.
completely a chemical imbalance, so to speak. And so, the problem is if you take somebody who's borderline and you're just throwing meds at them and you never do the therapy, you're consigning them to a life of medication. They're never going to get better. They're not even going to be all that well controlled. They'll, you would hope that at least somewhere along the line somebody's going to say, wow, you've been misdiagnosed,
Right.
and we can give you an intervention that can fix you.
But even with those who have been properly diagnosed with bipolar disorder, the addition of psychotherapy or of talking through the problems, I think my personal experience in having people I know, and even with dealing with my own childhood experiences, is that in drug abuse, in all these different areas, sexual abuse, things transpire throughout your life that if they're not talked through, you have some of these symptoms that can be misdiagnosed. But with bipolar disorder, and even our guest later on today speaks about how important it is to not only have the help with medicinal, but also then having therapy and talking through.
Well, sure. And here's the thing, that's true about every diagnosis in mental health. And the reason is, you want to teach patients symptom recognition and management. You manage symptoms by decreasing stressors in their life, making sure they have a good diet, good sleep habits, good exercise. You want the family to be educated as to the symptoms of the illness.
Families quite often, though, don't want to dig deeper into what the core of the problems are. That's what I've done some interventions,
Well, sure.
and it's hard. It's such hard work.
Well, I'm talking idealistically too.
So what do you come across when idealistically? But I would imagine you find a lot of people who want to fix it all, happy pill, and now everything's going to be fine as long as I take this medication.
Oh, that's the majority of everybody. My gosh, I had a patient I get so many, but I'm thinking right off the top of my head. I had a patient show up in the office, and I told him, I said, look, you need psychotherapy, and that will take care of your issues. It was a mom brought in their 17-year-old son, and I said, okay, you know, she thought that he had attention deficit. Turns out that he had an anxiety disorder that was causing the poor concentration. And that anxiety disorder was something that was environmentally introduced, the way that he was thinking about things. And I said, wow, this is perfect for therapy. See, I'm one of those odd psychiatrists that are not real pro medication.
That's good, in my opinion.
You know, and then I say, you know, let's do everything else. And then if we need to do medication, I do believe in being aggressive at that point. But they were absolutely insistent, no, let's use this medication. And I'm trying to explain to them that's a slippery slope. That's slippery to say, but a slippery slope, because I have a saying, and it's I didn't make it up. I've heard it in psychiatry. Once on a psych med that works, always on a psych med that works. Because once you start inducing a chemical change and you're changing brain chemistry, the brain is part of the body. It's a responsive system, and it starts changing to accommodate that. I mean, you know, your brain is like a thermostat monitoring 100,000 things at any one time. I mean, we're not thinking about the temperature in this room until I mention it. But if it changed, you'd know it immediately. Sure.
Right. Now, as far as the age, you mentioned a mother bringing in a 17-year-old. Is that what you said?
Yes.
Now, I want to talk a little bit on that because one of my daughter's that was not happy news for me, first boyfriends apparently was diagnosed with bipolar disorder. And he was on medications. And at that point, he was only like 16. Now, in my reading, as it was evident that most people, symptoms start showing, but not all, closer to around the age of 20.
Correct. Late teens, early 20s.
So when you're dealing with a child that's displaying, so what do you know statistics of, you know?
You know, not off the top of my head, and I'm embarrassed to say that because,
That's
you
okay,
know, well, no, I say I'm embarrassed to say that because at one time in my life I was a medical director for a children's inpatient unit age 12 and under. And it was in the early 90s, and it was at a time when bipolar was starting to ramp up, and more people were considering it in a young child, and you know, but it is rare. It is rare. You know, there are people who look at schizophrenia and look at bipolar in childhood, and I've seen it, but it's a rarity.
Yeah, and what I saw looking from the outside looking in was that, unfortunately, in upper middle class, and I'm going to address it that way, when families are dispersed, parents are working insane amount of hours to sustain their lifestyle, and they're not spending time with the family. All these children are cropping up with these different disorders.
You're getting me now.
Well, I'm seeing this because I have 5 children of my own, and I'm watching other families say, well, they've got this, that, and I'm like, and I know for a fact that kid is alone the majority of the time, so I can only imagine what's going through their head.
One of my pet peeves, actually, because I have a saying. I say, you know, kids are raised in drama class. And what I mean by that is they're raised in front of the TV.
Yeah.
And that's my big thing. You know, back in the 50s when it was I Love Lucy, it was still silly. It wasn't what real life was. I mean, you know, I was raised in the 60s, and you watch how it's progressed. Now you got kids being raised in front of Family Guy. You look at the dysfunction that is supposed to be funny, but the problem is you're not giving these kids role models that are role modeling normal behavior. So what they're seeing on the screen, they're considering as normal. And I see a ton of that. I mean, I'm seeing a lot of what I consider induced character pathology from being raised in drama class.
I want to talk about that more when we come back.
Sure.
We're going to cut for another commercial, and we'll be right back. Thank you. Yeah,
This segment has been brought to you by Horn Photo and the Bellagio at River Park. For all of your photo and camera needs, go to Horn Photo in the Bellagio at River Park.
Family photos tell your stories. Faces, places, milestones, and moments. You probably meant to preserve those memories. But where are those pictures now? Hiding in boxes or inside the discoloring pages of old albums? Do you own hours of home movies and videotapes that you can't even watch? Slides and negatives that you've saved for all these years and never get to see? Think of all of those precious memories that you've saved from the past to share with the future. Thanks to technology, we're taking more photos than ever, but we're not printing them like we should. Those digital images are held hostage on phones, tablets, and hard drives, leaving them as high-risk targets for accidents and hardware failure. What will happen to all of these images that tell your life story? Cherish those captured memories, not by hiding them, but by safely saving them. Put this overwhelming task on your own agenda or enlist Horn Photo's expertise. Horn Photo provides hands-on help from day one with organizing, scanning, restoring, and duplicating photographs. We can digitize your print and video memories onto DVD for easy viewing and safe, efficient storage. All you need to do is gather your prints, slides, negatives, and videos, then bring them into Horn Photo, where we will care for your cherished memories. In most cases, you can pick up your originals and your DVD within a few days. Once everything is on DVD, it's easy and affordable to order copies of your DVD for your children, siblings, and the rest of your family, so that you can share your memories with everyone. The best part is what can happen once your memories are digitized. We will show you how to transform your pictures into keepsake photo gifts and products you can enjoy for years to come. Don't wait for a disaster to destroy your collection of memories. Take steps to sort, save, and share your life in photos, whether you do it yourself or have Horn Photo help. Stop into Horn Photo and see our full range of solutions for saving and sharing your precious memories.
You can advertise your business, your product, or your event on Central Valley Talk, the Valley's only internet television station. Several of our programs are also picked up on Dish and cable networks. For the best advertising dollar, call Central Valley Talk at 579-1360.
CentralValleyTalk.com.
Hi, you're tuned in to Courageous Journeys, and I'm here with Dr. Bradley T. Wajda, and we're discussing bipolar disorder. Dr. Wajda, I want you to actually speak to us about some of the treatments that you offer or for looking at bipolar disorder. And we have a slide that we're going to bring in at this point, which is slide number 4 for medications used to treat bipolar disorder.
Oh, I was going to start with human sacrifice, but we can start with medication.
Human sacrifice is good, and I had hoped to go back into I had hoped to go back into talking about children and misdiagnosis, but there's so much content on this topic that we're going to have a few programs on it, just because we're not able to cover it in 10-minute segments. Okay, so with regards to, you talked about some of the misdiagnosis, you talked about, we spoke on children. Now, as far as your types of treatments that you look at with regards to bipolar disorder, what are those?
Well, I mean, once I've made the diagnosis of bipolar, and as your next guest pointed out earlier, before, off the air, it's very important to look at comorbid conditions to see what you're looking at, and make sure that you're looking at the patient as a whole. And also, we mentioned about family. In the ideal situation, you're going to want to bring all those folks to bear. You're going to want family to be educated. You're going to want to explain to them what I call the longitudinal course of bipolar, so that they understand. Look out for these mood swings. That's part of treating symptom recognition and management. We mentioned diet, exercise, those things. But I always do laboratory testing. I mean, that's an absolute necessity, because they can still look bipolar, but maybe this mania is caused by hyperthyroidism. I mean, you do a test and you find out that their thyroid's on overload. And, so of course they're not sleeping. Of course they're agitated and they're going 100 miles an hour. all of a sudden it becomes a medical diagnosis and not a psychiatric diagnosis. So, it can also be a medication issue. Maybe their doctor recently put them on a steroid because they've got asthma. I mean, for crying out loud, it's the Central Valley,
Wow.
right?
Yeah.
But one of the big side effects of steroids is a manic episode. So, or on the flip side, you could have somebody who normally has ADHD and they seem very energetic, and you put them on a steroid, which also can cause depression as a side effect. So somebody looks at that and says, well, gosh, they were bouncing around and they were all over the place up here. Now they're depressed. Aha. So I make sure we rule all that out.
Okay. And so the first step would be that they see their regular physician, right? To do
Well-
some testing as far as...
Honestly, and general practitioners out there, I love you. You're overworked. And this is no slam against you at all. It's what we do in psychiatry. I mean, we are medical physicians trained to know, or at least we're supposed to know, what medically mimics psychiatric illness. So, in all honesty, you should start with the psychiatrist who should be able to look at that and know if you're going to go to the endocrinologist, back to the family doctor, to the pulmonologist, if it's presenting as psychiatric. I mean, hey, it's our specialty. We should know what's happening.
Okay. Well, because I read that, with regards to like brain tumors, and we did have some guests on here earlier in our programming with brain tumors or other issues with damaged, injuries, that some of these things can come out too. So, then when you are looking at them and evaluating them, you can tell the difference if there may be an injury to the brain or they may have a tumor versus an actual disorder.
Had to make the diagnosis of glioblastoma multiforme brain tumor not a few weeks ago, and somebody that came in the office. It's like you look at that, you see the symptoms. Again, as a physician, your job is to notice. And in that particular patient, one of the things I noticed was they seemed a little unstable on their feet. And when I did a brief neurological exam on them, they were ignoring their left side. And it was like, wow, you need to go. We're going to do an MRI. We're going to do the labs. Next thing you know, I get an emergent call from the radiologist. And so, yeah, again, that is our area of expertise.
That's good to know. That's good to know, because I was unclear on that for sure. I think we got a little mixed up on our slides, so I'm not going to worry about that. We're going to just continue on so we don't miss any critical information. As far as, bear with me here. We talked to therapies. So when you are working with a patient, now you've got that cocktail worked on finding out the right combination of medications to help them with their bipolar disorder.
Right.
Do you have in your own office people that help them talk through their problems as well with the psychotherapy, or do they have to go outside?
No, we have therapists there. I use therapists outside the office. I'm very biased in my referrals to therapists. I have, and this includes psychiatrists, and here I am, I'm going to say that I have a saying, and I apologize to the teachers in your audience ahead of time. I have a saying, those who can't do teach, those who can't teach go into mental health. We seem to have an awful, let's just suffice it to say you can go outside, throw a rock, and hit a therapist, but you can throw for weeks until you hit a good one. And so I try to identify those folks out in the community. When it comes to therapy, and you mentioned cocktail, one thing I did want to mention very quickly again
Please.
is if in bipolar, depression is often, most of the time, a part of it, and typical antidepressants are contraindicated. You don't give them because it can actually activate the patient into going into a mania. So getting that cocktail right is very important. But at that point, what you want to do with somebody with bipolar is education of the patient and the family. And I say family, but any loved one.
Yeah.
caregivers.
Support network.
Absolutely. And you're going to help them look at whether or not they're in a position to continue making a living, or what their options are for disability income.
Are they eligible for disability
They
income?
used to not be, but they are now.
Okay.
That changed actually many years ago, but I'm old, and when I first got into this, it was actually considered something that did not qualify for disability with Social Security. And you're going to, again, want to pay attention and educate them about sleep, diet, exercise, but you're going to want to do that with anybody that has not only mental health illness, but I mean, it's good for all of us to attend to those things.
Most definitely. Now, because our next guest suffers from ADHD and bipolar disorder, can you talk about the issues with medicating both those?
Sure. Of course, it reminds me of when I told somebody I was ADHD and psychic. I knew things ahead of time, but I just couldn't remember the order.
That's the problem on my show.
Bad.
Sorry.
But, and again, you have to, it requires a very careful history, because the official diagnosis of ADHD, those symptoms have to be present by the age of 7. And so that's how you're really going to know. So if the symptoms of ADHD were present by the age of 7, and then say at late teens, early 20s, they have the onset of bipolar disorder, you're dealing with both. And of course, then managing that ADHD is important. And a lot of it at that point, it depends on that patient's history. Have they been managing it with medication? I mean, there are a lot of people who have ADHD throughout adolescence, but once their brain development is complete around 18, 19, right around in there, they no longer experience their ADHD.
Oh, that's interesting.
Well, when you think about, and I know we're not talking about ADHD, but when you think about what the etiology or the cause is, your brain's developing. Your brain is almost like a computer, ones and zeros, pluses and minuses. I mean, it's an electrochemical organ, and it operates off of positively charged chemicals or negatively charged chemicals. So you have excitatory chemicals and inhibitory chemicals. As your brain develops, part of the brain makes the excitatory, the other part of the brain makes inhibitory. If your brain's not developing evenly, if you will, that's very oversimplified, you'll be making too much excitatory. That's why giving something that would otherwise create a stimulus, why a stimulant would calm somebody down, is because it's stimulating the other part of the brain to make the inhibitory neurochemicals that should be made. That's why it seems contradictory. It's like, why would I give basically legal speed to my child and it would calm them down? Well, it's because it's actually speeding up or activating
the other side of
the side of the brain, or the area of the brain that is making the inhibitory response.
And so when you are dealing with somebody who has bipolar disorder and ADHD, you have to be very careful about stimulating that other side.
Well, because you really, you can't give that individual a stimulant anymore.
Okay.
Because you're going to throw them into a manic, and mania is way more destructive than not being able to focus. So
Right.
you're going to require doing some other things. And, I've never been a big advocate. I mean, I have to tell you, using stimulants for ADHD is way down on my list. I do actually naturopathic approaches first, because 15% of all ADHD is a zinc deficiency anyway.
I'm really glad to hear that.
So,
we're going to
yeah.
have another program on
Sorry.
ADHD. No. I don't mean to cut you off. But
No, I'm just
there's
saying I'm spinning off. But
and I do enough of that for both of us. But Dr. Wajda, I learned after inviting you to our show that you actually have a weekly program that you do. Can you tell our guests how to tune in to that? Because I'd like them to be able to listen to and learn more about these different issues.
Well, it's a rather irreverent program on talk radio, Power Talk 96.7, every Sunday evening at 6
Is that
p.m.
FM or AM?
FM.
Okay.
It's Power Talk here in Fresno. It's also 1400 AM out of Visalia. And We're on iHeartRadio. You can find us there. If you go to the website for the radio show, which is www.radiopsyched, spelled PSYCHED.com. All of our past shows are there. And we discuss a lot of stuff because it's a live show when it's done.
Yeah, like
and
this.
it's different. It is very different. But yeah, I love people to listen. We have a lot of folks who are who listen, during the week because maybe Sunday's not a great time for them to tune in.
So it's normally on Sunday evenings? Or?
Sunday evenings at 6 p.m. from 6 to 7. They can catch me Fridays at 11 a.m. on KC24 doing a little mental health update. And I write for Fresno Life magazine.
Wonderful,
so, yeah.
Wonderful. So there's a lot of ways you can find more information and listen to Dr. Wajda about different areas of mental health. Dr. Wajda, is there anything else you would like to share with our guests before we end for today?
Oh, wow. Where do I start?
On bipolar disorder.
Yeah, well, like I said, the big thing is proper diagnosis. And then at that point, when you have that diagnosis, you need to realize that the medication, and you mentioned this earlier off the air, the medication is not like an antibiotic. You don't take it and then you feel better and then you don't need it anymore. Medication for bipolar is like medication you take for diabetes or high blood pressure. The reason your blood pressure is now normal is because you're taking the medication. The reason your blood sugar is normal is because you're taking the medication. The reason that you're now feeling like your normal self if you're bipolar and you have nice moods that are just, it's normally you, is because you're on the medication. I have so many people that get on the medication and because they feel better, they treat it like the antibiotic that it is not, and they stop it. And here's a problem with that. And it's been seen in a variety of different psychiatric medications. You can take a psychiatric medication, and 26 years ago or whatever, when I first started doing this, they used to encourage drug holidays. They'd say, take your patient and try to get them to go off their medication for a few months every year. They actually advocated for that. And the problem was, then you'd see the symptoms come back, and you'd restart the medication, and then when you'd restart it, it would only be about 90 to 95% as effective as it was the first time, and you'd see more side effects. You'd see side effects come back that weren't there, and you'd actually see that you were losing ground every time.
And so every time you stop and start, for those of you that are starting treatment or that have been on treatment, it's harder and harder to get back to a stable.
So once you find something that works, you're there. Count your blessings that you've got something that enables you to be you.
And make sure you use that resource of support network and family to also help you stay on track, right?
Absolutely.
Thank you so much for sharing with us today and coming in. I really appreciate your time.
It's been a pleasure.
Thank you. Thanks for tuning in. We'll be right back with our next guest, Kathy Salas, and we'll look forward to talking to you then.
This segment has been brought to you by Horn Photo in the Bellagio at River Park. For all of your photo and camera needs, go to Horn Photo in the Bellagio at River Park.
Family photos tell your stories. Faces, places, milestones, and moments. You probably meant to preserve those memories. But where are those pictures now? Hiding in boxes or inside the discoloring pages of old albums? Do you own hours of home movies and videotapes that you can't even watch? Slides and negatives that you've saved for all these years and you never get to see? Think of all those precious memories that you've saved from the past to share with the future. Thanks to technology, we're taking more photos than ever, but we're not printing them like we should. Those digital images are held hostage on phones, tablets, and hard drives, leaving them as high-risk targets for accidents and hardware failure. What will happen to all of these images that tell your life story? Cherish those captured memories, not by hiding them, but by safely saving them. Put this overwhelming task on your own agenda or enlist Horn Photo's expertise. Horn Photo provides hands-on help from day one. with organizing, scanning, restoring, and duplicating photographs. We can digitize your print and video memories onto DVD for easy viewing and safe, efficient storage. All you need to do is gather your prints, slides, negatives, and videos, then bring them into Horn Photo, where we will care for your cherished memories. In most cases, you can pick up your originals and your DVD within a few days. Once everything is on DVD, it's easy and affordable to order copies of your DVD for your children, siblings, and the rest of your family, so that you can share your memories with everyone. The best part is what can happen once your memories are digitized. We will show you how to transform your pictures into keepsake photo gifts and products you can enjoy for years to come. Don't wait for a disaster to destroy your collection of memories. Take steps to sort, save, and share your life in photos, whether you do it yourself or have Horn Photo help. Stop into Horn Photo and see our full range of solutions for saving and sharing your precious memories.
You can advertise your business, your product, or your event on Central Valley Talk, the Valley's only internet television station. Several of our programs are also picked up on Dish and cable networks. For the best advertising dollar, call Central Valley Talk at 579-1360.
CentralValleyTalk.com.
You are tuned in to Courageous Journeys, and we are discussing living with bipolar disorder. Our next guest is Kathy Salas. She's a local resident, has lived with bipolar disorder and ADHD. She has succeeded in living a pretty normal life other than dealing with bipolar disorder. Unfortunately, she wasn't diagnosed with ADHD, which is interesting by what we just heard from Dr. Wajda, that children are normally diagnosed at 7. I beg to differ, having my own challenges with kids being diagnosed. But you were diagnosed with ADHD at 41 and not bipolar disorder until age 55.
That's right.
But she excelled in sales in different areas of her life. You know, I think Dr. Wajda touched on quite often people just think that you are extremely productive and extremely creative, but in effect you are having symptoms of bipolar disorder. So welcome, Kathy, and thank you for sharing your story with us, because for us on Courageous Journeys, that's really what it's all about, is our personal stories and expertise to help others out there who are suffering. Kathy actually uses her own life experience to help others control their bipolar disorder and ADHD and be able to function pretty normal lives. So I want you to share, first of all, your story of how you came to. You mentioned to me, and I'm going to backtrack.
Sure.
In a personal discussion that for several years you knew something was wrong. That's where I'd like to start. But you would mask that. Can you speak to our guests about that a little bit?
Sure. As my mother said, this explains my life. I was growing up I remember being depressed at 8 years old and hiding it, trying to hide it, not trying to cry. And something's wrong with me. And I grew up, and still until even past 55, there's something wrong with me. There's something wrong with me, and I don't know what it is, and it's just there. Everybody else is good, but there's something wrong with me, and I try to hide it. I build facades. You know, if I were going to go to a sales meeting, I would be the sales facade, and nobody could see who I really am because I was, by 55, getting very, very good at it. And along the way, there were people that I hurt, because even before I started building these facades, and even as I was going along, I was doing some pretty bad, life-changing manic episodes. The first one that I really remember is huge, and I was married, had a 3-year-old daughter who I loved dearly, and one day, I don't know why, I got $100. This is like in 1973, $100 and a one-way ticket to Vancouver, Canada.
Just the spur of the moment. You
Yeah,
just
I thought I
decided
was
you were
go-
going to Canada.
Yeah, I thought I was going to go visit a friend in Banff who was an artist, that I would stay with her. I didn't call her and ask if it was okay to come, if she had room, whatever. And so I did it. I just went there, and I had to talk. I was very good at it. I had to talk the guys that let you into their country, that it would be okay to let me in, even though I had just a one-way ticket.
So
They-
you got through into Canada with a one-way ticket, spur of the moment.
Barbara had no room for me. There was nothing
didn't
for me
know
to
you
do.
were coming.
No, so I stayed in a youth hostel for a couple of weeks, and then I came home. And I have no idea at this time how I got home, for starters. And when I got home, I obviously came home to no marriage and a divorce being filed, and for him to have custody because I was an unfit mother. And I was at that time. And I really hurt my daughter. She spent her whole life wondering why her mother didn't love her. And, things like that. I've done 2 or 3 things that were really
Major.
life-changing like that. The rest of them weren't so bad. They were not so good either. But I did call up, as part of my recovery, I called up the people that I could get a hold of that I felt that I hurt along the way, and there were many, and I called them and apologized to them and explained to them that I had bipolar disorder, and that kind of thing that I did is one of the symptoms, and I'm not trying to make excuses, and I'm really sorry that I hurt you.
You still owned responsibility, but you asked for forgiveness, which is a key part of healing for everybody.
Yes. So actually my mom and my stepdad thought something was wrong. They started getting the idea something was wrong, and they took me to a psychiatrist.
How old were you at that point? I'm sorry.
I was 55.
Okay. Oh, they took you to the psychiatrist at 55.
Yeah, they took me, and then I thought they were crazy. I don't have bipolar because that was manic depression.
You're like, you're the crazy one. Not me.
Yeah. And so I said, okay, I'll take this medication for a month. We'll meet here in a month, to my boss and to somebody that I worked with pretty closely. And then if you see any differences, okay, I'll go along with this. And I walked in the door after 30 days, and they said, keep taking the pills, even before I asked. Keep
They were
taking
counting
them.
down the days, huh? They were watching very closely.
Yeah, they were. And as I came along in sales, I was very fortunate to have sales managers that knew that I had ADHD and were able, to help me. They told me to keep some medication at work so that if I forgot to take it, they would know.
Right, they could tell. And so that's a blessing to have people supportive throughout your own journey, because quite often we don't have that. And for those that are self-employed or entrepreneurs that don't have people watching what's going on throughout the days and watching the ups and downs, I think it's even more challenging.
Sure.
But let's talk really quickly about further in depth how people should, who have bipolar disorder and possibly ADHD, what they need to do. Who do they need to reach out to, and what kind of things do they need to do to take care of themselves to stay on track?
Well, the first thing, and we're all really strong enough to do this, but we have to be strong to be committed to follow through with, just to be able to follow through for the rest of your life. Know it. It's for the rest of my life. Maybe I feel better now, but that's because of the medication. It's the rest of my life. I have to eat well. I have to exercise. I have to do these things. And if I do, then I will live my life like everybody else lives their life. And so you have to be totally committed and understand, what it is, get an education about what bipolar is. I have also, when you get diagnosed late like me, after you find out that you have bipolar, the next thing to do, and get your medication going, the next thing to do soon is to go to therapy. So you can start hitting that stuff that you've been through that has been pretty wild in your life, and get, knock down those walls, which takes a while.
Yeah, it's exhausting and very emotional just dealing with therapy, but it's critical.
That's
'Cause otherwise
critical.
you keep shoving it down, and never really crossing over that bridge, right?
Right. I'm a coach, and that's for moving forward, working with people, moving forward. And if people are just finding out, especially in later age, I suggest they just go to therapy for a while instead and not be coached, because there's
Yeah.
too much in the way.
There's too much. Now, do you keep, somewhere I read a life journal. Do you keep a life journal?
No.
Okay.
I mean, I do keep one, but I
Notes
rarely
on how you're
write
doing
in it.
Okay.
That's the ADHD part of me, which is I'm not medicated for anymore. And so I've had to come up with other strategies to handle that one. And one of them is I have a journal that I don't write in, and then I see it, and I'll write a couple things, and then maybe a month will go by. But that's something that's a really important, great idea that I don't follow through with. Another thing is having a support group around you. I have a team. There gets to be a time, and I had this happen recently, where I can't make my own decisions accurate, in my best interest. And I have a team that takes over. And
A support team.
A support team. And that includes my psychiatrist, my therapist, my coach, 3 of my best friends, and that's probably pretty much it. And my best friends, like my doctor, will call them when I was going through getting the medication fixed. It was still pretty wild. When that he felt I couldn't drive, he'd just grab my keys and he'd call my friends and ask them to come and pick me up. Both of them would come and take the car.
That's good that you have a support network. We are going to have Kathy back on our later programming in October to go further in depth on bipolar disorder and talking more about some of the techniques that you can use to help yourself once you have seen a psychiatrist and once you are on your meds and working through some of those issues. Then you can look at working with a coach. So thank you so much for tuning in today, and thank you, Kathy, so much for sharing a little bit. And we will talk again with Kathy next month.
Thank you.
Thank you so much, Kathy. I appreciate your time and your
Central Valley Talk.